Today topic of discussion, introduction to anatomical term, organization of human body or basic anatomical terminology. So what are the terminology we are using in anatomy? First, what is anatomy? It is a science of body, structure and relationship among them. So in this field of anatomy, we will study the body structure and relationship among them. Second one is physiology. This one is the science of body functioning. So study of body structure and the relationship, that field anatomy, and their function we are studying, that one name is called as physiology. Say for example, ears help to us to listen, like that functioning point of view. Here we are studying here how that structure is presented, that one is the anatomy. Next one is anatomical position. To study some specific or particular body part. So what is anatomical position? Here we study some specific or particular body part. Description of any region or part of the human body that is in specific stance called this anatomical position. So here we study some specific part or particular body part, any region or any part of the human body here we want to study. So in this anatomical position, that subject or person, it should be stand. So erect means fixed in upright position, and that facing observer, eyes facing forward and body is upright. This is the position. This is the anatomical position. So body erect, feel slightly upward, palm facing towards and thumb point away from body. So like this. So next discussing lying position. What is lying position? It also have a numerical position, other name. So this one is described in two types. One is prone, another one is supine. Prone and supine. In this prone condition, body is lying and face down. Padukra position, இது வந்து குப்புற படுக்கிற position. So face, body is lying and face is upward. Here upward position, here face is down. Prone and this supine position, both are lying position, படுக்கிற position. இதில் வந்து face வந்து கீழ் நோக்கி இருக்கும், இங்கே வந்து upward position. Next, regional name. Body is divided into head and neck region, upper limb, then thorax, then abdomen and pelvis and lower limb. So we divided into 5 important parts. First one is head. Head is divided into skull and face. What is the use of a skull? Protect the brain. Face, it include eyes, nose, mouth, forehead, cheek and chin. Second one is neck, which support the head and attach to the trunk. Third one is trunk, include chest region, abdominal and pelvic region. Pelvic means hip region. Then upper limb attaches to the trunk, help of shoulder, consists of shoulder, armpit, arms, from shoulder to the elbow. Then forearms, wrist and hand. So upper limb part attached to the trunk. This one consists of shoulder, armpit, arm, forearm, wrist and hand. Then lower limb, This one attached to trunk. This part consists of buttocks, thigh region, knee to ankle, ankle and foot. So these are the regional name. We want to use Latin terminology, then only we can easily understand anatomy and physiology. So say for example, neck means we want to use that cervical region. Armpit means axillary region, like that. Head is known as cephalic, skull, cranial, face, facial, like that. These are the name anterior view terminology. In anatomy physiology, we are using Latin term. So normal English term and Latin term. First we want to discuss that anterior view and posterior view. So this one is the anterior view. So this nose, that Latin term, anatomical term, nasal, mouth, oral, neck, cervical. This point of this shoulder, acromial. Then this arm, pharyngeal. Then armpit, axial. Then front of that elbow, antecubital. Then forearm, antephalangeal. Then this wrist, corbel. Then the thumb, phalanx, palm, palmar. Then fingers, digital. Then genital region, pubic region. Then that patellar, anterior knee, patellar, anterior knee. Then this leg, crural. Then these whole things, foot, pedal. This ankle, ankle, dorsal. Then these toe, digitals, toes, digital. That great toe, kattai viral. That one name is called as hallux. Then peroneal. This one is the peroneal region. This one is the fibular. Then thigh region, femoral. Then groin, this region, inguinal. Then hip region, corax. Then pelvic. Then navel, umbilical. Then abdominal. Then breast, mammary. Then chest, thoracic. Then this breast bone here, sternal. Chin, mental. Cheek, buccal. Eyes, orbital. Forehead, frontal. So these are the things. Anatomical position, anterior view. These are the terms we are using in anatomy and physiology. Now we want to discuss what are the terminology used in this posterior view. First, head, cephalic. Then this part, upper extremity. This hand, manus. Then lower extremity. So in this head part we have ear, octic. Then back of head, occipital. Then that point of shoulder, acromial. Then spinal column, this spinal, vertebral. Then shoulder blade, this shoulder blade, scapular. Then arms, pharyngeal arm. Then back of that elbow, this one name is called as ocranon. So back of elbow, ocranon. Then back, dorsum or dorsal. Back region, dorsum or dorsal. Then this one is the lumbar. This one lion is the lumbar. Then that between that hip, this region sacral. Then this buttocks gluteal. Then between that anus and external genitalia, this region perineal. Then thigh region femoral. Then this back, this part back of knee popliteal. Then this half region calf sural. Then the knee calcaneal. Then sole plantar. So these are the terminology we are using in that posterior view. Now coming to anatomical position. First one is anterior position, vertical position. So this one nearer to that front organ located front side. Example, sternum anterior to that heart. Heart is back position and sternum is that anterior position. Second one is posterior or dorsal. This one nearer to that back of that body. Example, esophagus is posterior to trachea. The two pipeline from that pharynx, so esophagus is posterior to that trachea. Then medial, nearer to that midline. Example, ulna is medial to radius. Then lateral position just away from the midline. Example, lungs are lateral to heart. Both lungs are present lateral as compared to the heart. So lateral position, medial, posterior, then anterior, then intermediate between the two structure. For example, transverse colon. So this one is the ascending, this one is the descending colon. In between intermediate, this transverse colon is present. Then proximal, nearer to that attachment. For example, shoulder is proximal to the elbow, or humerus is proximal to radius. Then distal, this one also just away from that attachment. Example, these phalanges are distal to that carpal or humerus. Last one is superior, means towards, on the surface of the body. Okay, so superior means towards, on the surface of that body. Example, ribs are superior to lungs. On the superior means on the above side. Next one is deep, away from that surface of the body, inside, deep. So particular organ present deep inside. For example, rib or deep in the skin, or bone deep to the skin. So these are the things based on their position. Position. Right side, left side, superior, inferior, proximal, distal.